start in about 10 seconds. Welcome. Good morning, everybody, to the City of Kawartha Lakes COVID-19 Virtual Town Hall. My name is Ron Taylor. I'm the Chief Administrative Officer with the City of Kawartha Lakes. Our goal today is to share in a discussion important information about COVID-19, such as service updates and availability, community and primary care resources, and the latest news on testing, symptoms, and what to expect next. And I'm thrilled with us today are a number of panelists that will help inform the discussion. First, I'd like to introduce Dr. Lynn Noseworthy, Chief Medical Officer of Health, Haliburton, Kawartha, Pine Ridge District Health Unit. Morning. Kelly Isfan, who just recently joined us at the Ross Memorial Hospital as the new President and CEO. Congratulations and welcome.
Thanks, Ron.
We also have with us Barb Mildon, CEO of Community Care for the City of Kawartha Lakes.
Thank you. Good morning, everyone.
And we have Dr. Naomi Ecob, Family Doctor, Kawartha Lakes Family Health Team.
Good morning, everyone.
Good morning. And finally, last but not least, we also have our Chief, Andrew Rafton, with our Kawartha Lakes Paramedic Service.
Morning, everyone.
And thanks everybody for joining this morning. We'll begin with an update from each guest, each partner on behalf of their organizations, and then we'll move on to questions from our community that were received in advance of this meeting. Before we do, though, get started, I just want to touch on some opening remarks. So COVID-19, as all of you know, has dramatically changed the world, and certainly on a local level, it's no exception. Our community has been significantly impacted. We know that many families are grieving the loss of loved ones out there. And to those families, we extend our deepest condolences. We also recognize the efforts of all of the essential workers and healthcare workers in our community who have been on the front lines every day, protecting and working for us so that we can remain safe. It will take all of our continued efforts to stay safe. And all of us on the call today encourage you to continue to follow public health guidelines so that we can get through this pandemic together. From a municipal perspective, the word together has played a large role in the success of moving forward through the pandemic. The city has been working very closely with all of our community partners over the course of the past few months and has been following advice and guidelines outlined by our local health unit to always keep safety a priority. We've been hosting our weekly Emergency Operations Center, which includes many health partners on this forum today, to provide updates to one another, to maintain stability locally, to respond where and when we need to, and to keep communications consistent across all platforms. We've echoed all COVID-19 updates from the health unit, as well as the province, on all our communication channels and to further share our message. Our mayor has held weekly media calls to provide news outlets with the right information for the public. And as announcements continue to be delivered by the province, such as the introduction of a regional approach to stage 2, which begins tomorrow in the City of Kawartha Lakes, we ask for cooperation from everyone to be patient and support one another as we navigate through our reopening phases. With all that being said, I'd like to move on to the roundtable updates from our panelists, who will each share how their organization has been responding to COVID-19 and what you can expect if you need to access their services. So first, I'd like to welcome Dr. Lynn Noseworthy from the Haliburton Kawartha Pine Ridge District Health Unit to speak to our local public health team's work to minimize the spread of COVID-19.
Thank you, Mr. Taylor. Good morning, everyone. When I first agreed to participate in this virtual town hall a few weeks ago, I thought I would speak about the health unit's COVID-19 response and the public health messaging we have been sharing. Assume other people have COVID-19 and conduct yourself accordingly. So maintain physical distancing, wash your hands frequently and thoroughly, cough or sneeze into a tissue, or your elbow if you don't have a tissue. Wear a face mask or covering when you go out and cannot maintain a 6 feet or 2-meter distance from other people, and stay home if you're ill. These are all still very important messages, but so much has changed in just a couple of weeks. We now have an expanded testing strategy from the province that enables anyone with or without symptoms to be tested. The Premier has announced a regional approach to the reopening of services, and starting tomorrow, businesses within our area are being permitted to open under stage 2 of the province's recovery plan. And with the recent death of George Floyd in Minneapolis, Minnesota, we are witnessing demonstrations around the world as people speak out against anti-Black racism. If there is one thing that can be said about 2020, it's that it's a year of change. It all began late last December when we started hearing about a new virus that had appeared in Wuhan, Hubei province, China. By the end of January, we saw the first case of the novel coronavirus in Canada. And on March 14th, we saw our first case of COVID-19 in the city of Kawartha Lakes. It's amazing how quickly things escalated and the world changed for all of us. In January, the Health Unit reviewed its pandemic plan and began ramping up its response to prepare for the potential arrival of this new virus. Since then, we've been meeting regularly with the Ministry of Health and Public Health Ontario to learn all we could about this new virus, what it is, how it's transmitted, the symptoms it causes, how to test for it, and public health measures to prevent infection. This information continues to evolve. The Health Unit set up a call center to respond to the hundreds of phone calls coming in daily from healthcare providers, community agencies, municipal governments, school boards, and members of the public. We continue to receive phone calls and provide many resources on our website for the public. We've sent information packages to community groups, businesses, and organizations to assist throughout the pandemic, and are now providing resources to support businesses and organizations in the reopening of the province. We put most of our public health programs and services on hold and moved our staff into the response work until the majority of our 135 staff were working solely on our pandemic response. Many of our staff now work on case and contact management, a lengthy process which involves contacting each confirmed case and reviewing everywhere they went and every person they were in contact with during their infectious period, which is 48 hours before the symptoms begin. We've worked closely with our healthcare providers, preparing for cases and helping to set up assessment centers for testing. We've worked with our municipal partners, organizations that oversee congregate settings like shelters and retirement homes, and farmers who are bringing migrant workers into the province to work. The city of Kawartha Lakes is one of 3 upper-tier municipalities served by the Haliburton Kawartha Primary District Health Unit, and unfortunately is the area within our jurisdiction where we have seen most of our cases. As of today, there are a total of 156 cases in CKL and 32 deaths, 28 of which are related to the outbreak at the Pinecrest Nursing Home. We are now entering the second phase of the province's reopening. Our health unit is one of the areas permitted to move into stage 2. While I know we're all happy to see the return of hair salons, outdoor dine-in services at restaurants, and an increase in the number of people we can now see, I urge you all to remember the public health measures that helped us prevent the spread of the virus. We all need to be diligent in continuing to practice physical distancing, wash our hands thoroughly, wear a mask or face covering when we are out and cannot maintain that 6 feet or 2 meters of separation from other people, cover coughs and sneezes with a tissue, and stay home if we are ill. We are entering a new normal, but it is still far from the normal we knew in the past. We need to continue to work to protect ourselves and others from the virus. Without a vaccine, these public health measures are the only things keeping us healthy and helping to stop the spread of the virus. I frequently get asked about wearing masks. Initially, it appeared that there was no reason for people to wear a mask when out in public, and that only those caring for others should wear a medical mask. As I said previously, we are constantly learning new things about the virus and evolving our messages about how to protect ourselves from this virus. We came to learn that many people who have the virus are asymptomatic and could be spreading the virus without realizing it. That is why the messaging changed, and we are now recommending people wear masks when they are out and cannot guarantee a 6-foot distance from others. When we wear a mask, it is to protect others from any virus that we may be spreading unknowingly. As we see many more retail businesses and workplaces open in the province, it's important that they follow provincial guidelines to implement safety measures to protect their workers, clients, and the public, which may include the use of barriers, physical distancing, hand sanitizers, and the use of masks. I have been very pleased to also see the use of masks and physical distancing in the media coverage of recent demonstrations against anti-Black racism. We all have a duty to speak out against racism, and it's encouraging to me to see people do it safely. There is no room for racism in our world, and public health has been working for many years to put an end to racism. We know that visible minorities are often at a disadvantage when it comes to health. They are often living closer to others in crowded neighborhoods, do not have access to higher education, so they do not get good paying jobs. Because of that, they do not have enough money for healthy foods and may not have access to the healthcare services we often take for granted. Data from around the world have shown that those living in poverty, visible minorities, and older adults have been the hardest hit by this virus, and we need to find a way to end all racism, address poverty, and protect our older adults so that we can ensure the health and well-being of all people. In closing, my message to you all is that we need to continue to be diligent about protecting ourselves and others against this devastating virus. We need to be considerate, kind, caring, and support all people, whatever their age, gender, or race, to stay healthy. That, to me, is a new normal worth achieving. Thank you.
Thank you very much, Dr. Noseworthy. And I would also like to extend a thank you to your entire team for all of your continued hard work to keep safety in our community a priority. So thank you for that. Next, if we could, I'd like to hear from Kelly Isfan, President and CEO of Ross Memorial Hospital in Lindsay. Kelly.
Good morning, and thanks, Ron. And first, I'd like to start with a big thanks to people in our community. We've seen really positive community support, monetary donations, donations of personal protective equipment, people sewing cloth masks for others. And just by staying home, people are helping us in the hospital and healthcare workers everywhere do our jobs. So a big thanks to our community. As a new resident of the city of Kawartha Lakes, it's been a great introduction for me and such a positive community. There was lots to learn, as Dr. Noseworthy said, with the beginning of COVID-19, but the RMH team was really quick to adapt. And there was a number of steps we took. We've got a lot of direction from the Ministry of Health and Ontario Health. There are new directives, especially at the beginning, coming out every day. And consistent with those directives, we created inpatient capacity by postponing all non-essential surgeries and services. We limited the access to the hospital to the one front entrance only, and began actively screening our own staff and patients coming in through that entrance. We were directed to minimize all people in the hospital, so we paused all volunteering and put a stop to all non-essential visitors. And there's certainly a human price to pay for that, but consistent with ministry direction, we're only allowing visitors for delivering mums and for people at end of life. And that direction continues today. We are helping our patients stay in touch virtually. Counseling groups have iPads. We're helping with family visits through iPads for our long stay patients as well. We've been doing lots of continuing education for our staff. Our staff use PPE, personal protective equipment, all the time, but certainly as knowledge improved in this COVID-19 pandemic, we had to continually refresh that education and keep up with the updates on that. On March 15th, we launched the drive-through assessment for the community, at the Lindsay Exhibition Grounds, and we're still there today. And we have a partnership with Kawartha Lakes Paramedic Services to help provide the in-home testing and surveillance for people that can't get to that center. And together with EMS, we have done surveillance testing for long-term care, retirement homes, and other congregate living facilities. To date, we've assessed more than 2,000 people and have done testing swabs on more than 1,000. And you can get a test if you want or need one. We encourage you to call ahead first so that you can minimize any waiting. The number is 705-328-6217. Our infection prevention and control team visited every long-term care facility and retirement home in the city of Kawartha Lakes to help review their own practices and provide support if needed. And I'm really pleased to say we were very warmly welcomed in these facilities, and we continue to work with any of the facilities that need more help to address ongoing challenges. Further to that, our RMH staff volunteered to support Pinecrest Nursing Home in Bobcaygeon. We deployed a nurse there for several weeks, and we also had people from our environmental services team there to do a thorough, deep clean of the entire home. Our staff really enjoyed the experience, and they were very honored to support Pinecrest and the residents during that challenging time. During this entire pandemic, we've worked with Lynn Noseworthy staff at Public Health, with Ontario Health provincially, healthcare partners and private donors. We have acquired and preserved PPE and made sure that our community partners, community caregivers that still needed it, got it. And we were happy to help support with that. We're now starting to ramp up our hospital services again, and we're really excited about that. We've been operating our surgical program at about 50% capacity for the last 2 weeks. That has been in concert with hospitals in this region. So we've done that joint planning approach, take a very careful and mindful approach to ramping up those services. Safety is always top of mind. Our pre-op patients are tested for COVID-19 prior to their procedure. And as we continue to ramp up, we'll get more information about that out to the community in the coming weeks. If you are coming to hospital, you will be asked to wear a cloth mask. You can bring your own if you have it. We also have them here, and we'll give you one to keep if you need that too. And as Dr. Noseworthy said, please do wear your cloth mask, not only at RMH, wear it elsewhere if you can't distance yourself to protect other people. We really do need to keep in mind that even as we're going to a stage 2 reopening, we're still in pandemic, and we still need to keep flattening the curve. There's a pattern and instructions on how to make a cloth mask on our website, rmh.org. I'm so grateful and so proud of our RMH team of staff and doctors. Everyone has an important role to play, and really so impressed as a new CEO with how quickly people here adapted to the new normal and COVID-19 response. So in summary, I'm really grateful to the collaboration of our partners on this call and to other healthcare partners in the community, as well to the larger community, the city of Kawartha Lakes, for everything people have done to support the hospital. And again, you can always go to rmh.org for more news on what we're doing here at the hospital. Thanks, Ron.
Thank you very much, Kelly. And again, I'll repeat, welcome to the community. It's probably an odd way to enter a community, but it's great to hear your experience even just to date with all of the other partners. As you know, and all of us know, the hospital has been a vital partner and has done a remarkably good job in providing insights and information to the municipality about ability and best practices to protect residents who need to visit Ross Memorial. So we are very grateful for all the work that you and all of your team there continue to do. So thank you.
Thanks. I think we've all across the community really risen to the occasion. Thanks.
The next panelist that we'd like to hear from is Dr. Naomi Ecob, who will share an update from a primary care perspective. So welcome, Naomi. Morning. Sorry, Dr. Ecob, I believe the mute is still on.
There now.
I can hear you. Great, thank you.
Thank you. And hello, everybody. I'm Dr. Naomi Ecob, a physician with the Kawartha Lakes Family Health Team, and I'm pleased to provide an update on behalf of family care, primary care. The family doctors of the City of Kawartha Lakes continue to work hard to care for all members of our community. Our offices are open and offer acute care, ongoing chronic disease management, and preventive care. Times are changing and challenging, and so is the way we practice medicine. But our goal remains consistent: to keep our patients and our teams as safe as possible. Appointments are now mostly virtually, i.e. not in the office, via telephone, video, and sometimes by email. But there are some patients who still do require in-person office visits. Those such as newborns, babies and children for their immunizations, necessary injections, and pregnancy. Or if the doctor is unable to make a diagnosis without a thorough examination in person. If an in-person visit is required, he or she will be called the day prior, or sometimes the same day, to screen for COVID symptoms. If positive, then the patient's asked to call the COVID assessment center. On arrival at the doctor's office at your appointment time, and please don't arrive more than about 5 or 10 minutes early. This is to help us comply with social distancing. Please, 1, read the posted signs. 2, wear your own mask. And if you don't have one, we have one we can provide for you. And 3, use the hand sanitizer to clean your hands thoroughly. The doctor will also wear a mask along with gloves and goggles. Note, in-person office visits are well spaced out, so there is no waiting room full of patients anymore, and hopefully no waiting. All our offices and medical equipment are cleaned appropriately at least 2 times a day and after each patient visit, according to public health guidelines. All family doctors generally follow the same office guidelines, but each doctor might do things a little different based on their office setup, their number of staff, and the patient population. So it's always best to call your family doctor to get up-to-date information, as the way we practice medicine will continue to change during the evolution of this pandemic. And please do not walk in without an appointment. Our after-hours clinic is open Monday to Friday, 6 to 9 p.m., Saturday, Sunday, and holidays, 9 to 12, for patients with or without a family doctor. Note, screening for COVID-19 is done just prior to registration. Also, do not avoid going to the ER or the hospital for fear of COVID exposure. If you have emergency, please seek emergency care as needed. If you or a family member think you have COVID-19, then contact the RMH Assessment Center, 705-328-6217 for an appointment. No one in the City of Kawartha Lakes will be left without safe, appropriate access to care. Remember to echo what Dr. Noseworthy said: stay home, only go out for essentials such as shopping, exercise, or appointments. Wear your mask when in public, social distance 6 feet away, and wash your hands frequently. Then we can all be safe, happy, and healthy together. Thank you.
Thank Thank you very much, Dr. Ecob. Appreciate that update, and certainly again, thank you. It's amazing. It's interesting to hear that, certainly amazing that access will not be denied, and that it's very interesting to hear how all of our local doctors and offices have had to adapt and adjust to this pandemic and the new normal, but they've done it heroically and extremely well. So please pass on those thanks on behalf of the community, and thank you for the update.
I will, thank you.
If I could next, I'd like to welcome Barb Mildon, the CEO of Community Care, City of Kawartha Lakes, for an update from her organization. Barb?
Thank you very much, and good morning, everyone. It's a real pleasure to be with you, and especially with the panelists. Each of you has been such a wonderful partner to Community Care over these months. So most of you, I think, on the call will know Community Care. We're proud to have been in the community for 35 years. You might perhaps be a client of one of our physicians or nurse practitioners in our community health clinic. You might receive our Meals on Wheels, or perhaps you've actually been driven in one of our very distinctive vans to one of your appointments or one of your social outings. We actually have a program of almost 40 different services, and so we touch many aspects of life in the city of Kawartha Lakes. And many of our programs are focused on helping seniors and adults live, those with special needs, live healthy, comfortable lives and connected lives, because we know that from a social determinants of health, that social connectivity is very important. Over the past few months with COVID, as you've been hearing already, we've also had to change the way that we deliver our care. However, we have been able to keep several of our most acutely needed services going. In some cases, we've been able to move services from in-person to virtual. Sorry, my finger must have touched that button. So although some of our programs may have looked differently, we have been able to keep the main ones going. One of the things we've seen is that our Meals on Wheels program has grown by almost 25%. And that makes sense as we look at those who needed to isolate at home and have more difficulty getting out to grocery stores. We've also, though, been able to continue our personal support services in people's homes and to continue supporting hospice services. So those who are grieving and who need support from a palliative care perspective. I'm also proud of our staff for developing new programs that responded to the needs that emerged throughout this time. So for example, we have a care crew that actually goes out and helps seniors and others with special needs by doing grocery shopping, picking up medications or other tasks that again help those individuals to safely self-isolate at home. We've also developed a social isolation and caregiver relief program. And that was in direct response to not being able to offer our adult day program during COVID. As you can imagine, you can't bring a group of vulnerable seniors together under pandemic conditions. Yet those seniors are still somewhat isolated at home, and their caregivers have quite a burden in having to care for them. So through this service, we send our staff into the home and provide that respite for both the caregiver and the engagement with the client. As I look ahead to where we are today and looking ahead especially to tomorrow and opening to phase 2, we're definitely continuing to increase our services and to ramp them up again. Of course, we are continuing to follow all of the ministry and public health guidelines as we do that. Our COVID management committee continues to meet weekly, and we receive the daily updates and share those with that team. I also really want to note that I'm very grateful to our boards of directors for both our organization and our foundation, who continue to meet monthly and for their committee meetings and provide their expertise and guidance to us throughout this time. Over the coming weeks, and with a focus on the week of June 22nd, we're ramping up our number of in-person appointments at our community health center. We're also resuming our foot care clinics that take place across the city of Kawartha Lakes. And we'll continue to keep our public updated through our website, www.cccKL.ca. I certainly look forward to working with the team here at Community Care in serving the community as we all make progress in our fight against this pandemic. And again, I want to express my support or my appreciation for the support and partnership we've received. In closing, I thought I would share two pieces of feedback from our clients that really gave us a wonderful, bright day. One of them is from a caregiver. I just wanted to say how much my mom is enjoying these meals and how we appreciate the service that you are offering. My mom said they're delicious and healthy. Also, when my mom got her Easter dinner, she was self-isolating at that time. It was delivered by an individual dressed like a bunny, and she just got such a kick out of that. I really would like whoever has contributed to this to know how much my mom and her daughter appreciate this service. And secondly, a more general one, I'd like to express my gratitude to everyone for doing so much through your services for our community during this unsettling time. So again, our clients and our caregivers are our North Star here at Community Care. We look forward to serving you. Again, to all of our partners, thank you for your support. And Ron, I'll turn it back to you.
Thank you very much, Barb, for that update. And I don't need to say it to this group, but certainly it's important. You know, Community Care has been a very large partner in providing a range of health and support services for people of all ages throughout the pandemic, but really throughout the community and ongoing even pre-pandemic. And it's important that we continue to work together to let our residents know the different types of supports that are available and out there for them. And so congratulations to you and your team, your volunteers to date. And certainly we look forward to many more years of partnership and support from your organization. Thank you.
Thank you again.
And next I would like to welcome Andrew Rafton, our Chief of Kawartha Lakes Paramedic Service, to provide an update from their service. Thank you.
Good morning, everyone. And thank you for the opportunity to comment on how COVID has impacted our local community paramedic service and the work that we do. These are unprecedented times, and the last 12 weeks have been stressful for all of us. But for frontline healthcare workers, including paramedics, working in this new, ever-changing environment every day has been exceptionally stressful, both physically, mentally, and emotionally. They face having to wear large amounts of protective equipment at times in extremely high conditions, and the stress that they could be coming into contact with the virus and taking it home to their families. Our paramedics are now faced with the reality that every patient they come into contact with could potentially test positive for the coronavirus, and thus take full protective precautions on each and every call. So as a member of the public, what can you expect if you need to call 911 for medical assistance? First, when you call for help, the ambulance call taker will ask you a series of questions to screen for the potential of COVID. For example, they will ask the person if they had close contact with anyone with acute respiratory illness or traveled outside of Ontario in the past 14 days. They'll ask, does the person have any of the following symptoms? Fever, new onset of cough, worsening cough, shortness of breath, sore throat, difficulty swallowing, chills, or a headache. Please remember to answer these questions honestly. Answering yes to any of these questions will assist the responding ambulance and will not delay our response in any way. Second, when the ambulance arrives, please do not approach them and understand that precautions must be taken to keep both you and our paramedic staff safe. Our staff have been directed to outfit themselves in full protective equipment for every call, which includes a surgical gown, mask, face shield, and gloves. Upon making contact, You will be asked, if able, to wear a surgical mask to reverse isolate. This will add an additional protective barrier between you and our paramedics. Once again, you will be asked a set of questions similar to those that were asked by the ambulance call taker to help determine whether you screen potentially positive or negative for COVID. Treatment and transport to the most appropriate medical facility will then proceed as normal, taking all necessary precautions. We have seen a noticeable reduction in call volume for paramedic service by as much as 35% in the first 3 months of the pandemic. But what we have noticed is an increase in our high acuity calls. This has led us to think that some of our residents are suffering in silence at home, resistant to call us when they are sick, not wanting to attend the emergency department because of this outbreak. Please monitor your health closely and call us if you need us. We are there for you. I am extremely proud of the exceptional care and compassion our paramedics continue to demonstrate every day throughout this health crisis. They have risen to the challenges they have been presented with, and I know their hard work and dedication is appreciated by all the members of our community. Throughout our response to this pandemic, we have established some very important community partnerships. One no greater than with our local hospital, the Ross Memorial. We have expanded our community paramedic program and are now a mobile extension of the Ross Memorial Hospital's COVID Assessment Center. Our team of community paramedics are able to offer in-home testing for those that are unable to travel to the drive-through assessment center here in Lindsay. We have completed over 100 tests of symptomatic clients. We have been able to provide follow-up visits to high-risk patients and have been able to support testing in Kawartha Lakes housing and our homeless population. We have been able to play an integral role in the surveillance testing in long-term care facilities and other congregate settings, helping to perform over 1,700 tests to this point. Moving forward, these tests of long-term care home staff will continue as part of the province's long-term strategy for testing. In return, the Ross Memorial has been able to assist our service with the critically important procurement of personal protective equipment. Availability of these essential items has been low since the start of the pandemic, and we have heavily relied on them to replenish our supply in order to keep our frontline paramedics safe. Personally, I cannot thank Veronica Nelson, Vice President of the Ross, enough for all of her dedication and efforts in securing this equipment for us. It has truly been a team effort. In the early days of the COVID outbreak, our service reached out to our Kawartha Lakes community for help with PPE procurement, and you responded. We were overwhelmed with donations from both businesses and individuals. These donations sustained us until we were able to adequately restore our own levels. You also responded with food donations to our crews, cards of thanks, lawn and window signs, all showing tremendous support for our frontline workers. And I can tell you our staff truly appreciated all of these wonderful and kind gestures. In closing, as our community prepares to enter phase 2 of the gradual reopening of the province, we need you to remain vigilant, just as our paramedics are doing. Now is not the time to become complacent. This health crisis is far from over, and we all need you to work to contain the transmission of this virus. Our staff urge all residents to continue the practice of physical distancing. Please avoid all large gatherings. Wear a cloth mask covering when you are out and cannot maintain a 6-foot separation from other people, and avoid touching your face while ensuring frequent and thorough hand washing. Remember, we are all in this together. Thank you.
Thank you so much, Chief Rafton, for those updates. And I certainly would like to echo your statements, particularly on community and partnership experienced throughout the past few months. It's been absolutely tremendous support that we have seen, and quite frankly, it is overwhelming. I think it's also important, whether it's your service and any of the organizations represented by the panelists, we're all laser focused on response to the pandemic, but at the same time, there was other functions that we did and looked at and helped support, and certainly all of your teams have done an absolute tremendous job of not losing sight of those functions as well, and supports that the community relies on ongoing. And I think with the paramedic service, obviously front and center from a municipal standpoint, I'd also like to use the opportunity to just acknowledge and thank the other local emergency services that also help and support various functions, including our health response, whether it's our municipal fire service or both of our local police services serving the area. So thank you for that. And thank you to all of you panelists for your updates from your organizations. So that concludes the organization remarks. What I'd like to do now is move on to our Q&A question and answer segment, where we ask residents to submit questions that they may have for our panelists. So please keep in mind that although these questions are directed at specific panelists, any other comments or additional responses that any of you would like to give are more than welcome. So I'm going to start first with a question that was to Dr. Noseworthy. With the province reopening some areas, including our health unit area, won't people from the GTA, which is not reopening yet, flock to the Kawarthas? How can everyone stay safe if so?
Thank you. A few months ago, when everything was closing down in the province, we started seeing a number of people traveling to their personal cottages. And the message at that time from the province was that people were asked to take all of their supplies with them, so they didn't need to make any additional stops along the way to minimize the people they came into contact with on their journey. They were also asked to follow the public health measures, and I'm very encouraged to hear everybody using the same language, because it is a very key message from a public health perspective. So stay home if they're ill, maintain physical distancing from others, and wear a mask if they could not maintain that 6-foot distance from other people. Now the province has introduced the second phase of the provincial reopening, and cottage rentals and resorts are once again able to operate and welcome guests. There have been a number of safety protocols recommended for all businesses to follow under the reopening, and cottage rentals and resorts are no different. Even though the restrictions are relaxing in many parts of the province, people are still asked to follow the public health recommendations. People are not being asked to self-isolate, but if they are ill, they should be staying home. If they're going out into the communities where the cottage is located, they should be maintaining physical distancing and wearing a mask when they are out, and cannot guarantee they can stay 6 feet apart from others. They should continue to wash their hands frequently and thoroughly, and use alcohol-based hand rub when they visit any retail stores or establishments wherever they travel. Communities in cottage country have always prepared for summer visitors, and it is no different this year. I think the assessment centers that are in place are centrally located and easy for people to visit if they are traveling to the area. Retail and grocery stores have the safety protocols in place, and any shoppers, whether they be local residents or cottagers, are asked to follow the safety measures in place at each establishment. Thank you.
Thank you for that. We'll move on to the next question, which was, can I accompany someone to the hospital in an ambulance? And so maybe I'll ask Chief Rafton for a response.
Thanks, Ron. And thank you for the great question and very relevant question. Unfortunately, there is not an easy answer. Because some individuals present with no symptoms and yet test positive for COVID, our paramedics are now directed to treat each and every patient as if they were positive and take full precautions, including the wearing of full PPE. So it's basically impossible to say that it would be a non-pandemic related call. Our paramedics will judge each incident separately. We encourage family members to remain at home if the problem is not serious and not accompany the patient to hospital. The hospitals as well are not encouraging visitors to their emergency departments for non-urgent patients. Obviously, if the call is of a more serious nature, then accompanying the patient would be considered by the crew. But you may be asked to wear some level of protective equipment and would be asked to ride in the driver's compartment of the ambulance and not in the back with the patient. I hope that answers the question.
Thank you for that, Chief.
Maybe I'll add to that, Ron.
You.
And again, the provincial direction for all Ontario hospitals is to reduce all non-essential visiting and family presence, and that includes emergency departments. There are really very few exceptions. We do allow an accompanying family member for minors or for compassionate reasons. That would include palliative care and end-of-life care, or if the patient themselves had a language barrier and it was useful to have a family member accompany them. But basically, we are assuming that everyone that comes through our doors may have COVID-19, and these restrictions are put in place for that reason. If you are coming to the emergency department, we do ask you to come alone. If you're coming outside of EMS, please come alone and wear a fabric mask if you have it. If not, we will provide one to you. I hope that helps a little bit with more information.
It does. Thank you for that, Kelly. In fact, while you're going, I'm going to pose the next question to you as well. So the resident is asking, how and where can I get tested for COVID-19?
Sure. So the assessment center, the testing center is at the Lindsay Fairgrounds. It's open 7 days a week. And we encourage you to phone ahead. And again, the number is 705-328-6217. You can come without an appointment, but we don't like people to have to endure wait times. So it's easier if you phone ahead and we'll assign you a time. It's a drive-through model there, so it's very easy. You don't have to get out of your vehicle. And as Chief Rafton said, there is in-home testing for people that, for various reasons, find it difficult to get to the fairgrounds, to the exhibition grounds. So we will, when you call into the assessment center, we will line that up in partnership with Kawartha Lakes Paramedics, and we're again grateful to them. Current assessment and testing information can always be found on our website, rmh.org, and I encourage you to go there as things change in the pandemic. Thanks, Ron.
Thank you. And I'm encouraged. We have a number of questions. I'm going to try and get through it, but recognizing we've got about 12 minutes left, but I would like to try to get through a significant amount of the questions. So I'm going to move right on, if I could, to Dr. Ecob. The question is, how have you found managing calls with patients virtually? Do you find that the interaction, other than the physical presence of being there, has changed when an appointment is held through a screen?
Well, it's definitely a challenge. Very different from the way I've practiced medicine for the past 30 years. So it is different, definitely. I found it often takes longer to speak to a patient rather than having a patient in front of you. On the phone, you lack some of the visual cues and some of the nonverbal cues that you get from patients in helping you make a diagnosis. So it often takes longer to make diagnosis, and even after a phone call, I've sometimes had to have patients come into the office and for a full examination. When you're using video, I think it's a little bit easier because you can see the patient and see their reactions. But again, you can only sort of see and look at the patient, maybe look at a rash or a bump, and see if they're having trouble, difficulty breathing. But you can't actually feel the lump. You can't look in the throat very well, can't look in the ear or listen to someone's heart or lungs. So it is limited. So again, there are times that then I have to say, well, I can only do so much. And have the patient come into the office after that. It's a different way of working, definitely.
Agreed. It's a different way, but it sounds like it's working. So that's
That's it. We manage.
able to adapt and do that.
We adapt. Yeah.
Barb, we have a question for your organization. How are you ensuring that everyone's safety when clients are receiving your services?
Thank you for the question. And I'm again very grateful to our staff and to our volunteers. We've had a core of about 40 volunteers who continue to work throughout COVID and most especially in our transportation area. So a couple of things. First of all, we do continue to follow all of the ministry directives. So everything that Dr. Noseworthy has said, that Dr. Ecob and others have emphasized, the social distancing or physical distancing as it's called is important. We've erected plexiglass barriers at high traffic areas. We've put screening information and hand disinfection protocols right in our entrances. Masks as well. You've heard others say they're available. We do have them available. If you are being transported in one of our vehicles, for example, in our volunteer drivers, you would sit in the back seat. We no longer have the client in the front seat along with the volunteer. Our waiting rooms have been reconfigured so that there is space between the chairs. And of course, things that would have been shared in the past, such as toys for children, magazines, have been removed. So it is a new normal for us. We continue to pay attention every day to the directives, but I would say that everything possible that we can do to protect the safety for our clients, for our staff, for our volunteers is definitely in place.
Thank you for that. We had a couple of questions for the municipality as well. So the question was, can you tell me more about opening trailer parks, beaches, or other seasonal services? And I guess I would just simply note that as a single tier municipality, we have so many different programs and services that we manage and deliver locally. Municipally, our response has been really focused on critical and emergency service response in the immediate term. And it's been mentioned by many of the panelists that we are starting to enter stage 2 and reopenings in various sectors. And as a municipality and a very large employer in the community, we're no exception. And so we are also looking at our various business units and opening them in compliance with provincial orders and also on the advice of local health. And that's going to be done sort of throughout the coming months. And it's really been more of a slow and steady approach. We certainly don't want to be reactive. We want to make sure that as we open these municipal services locally, that health and safety is priority one, not just for the public, but also for our staff that need to oversee those different functions. And so I would suggest to date, we've been quite responsive and cautious, and I don't see that ending over the summer. The announcements that were made very recently, all of our work areas are scrambling to look at what is the best way to open up the services, how will we do it? And it's been said a number of times, it won't be business as usual. It's business unusual, I like to always say, but we will expand on those services, but we're going to do it safely first and foremost. I'm going to move on to next question. This is for Dr. Noseworthy. Why doesn't the health unit provide more details about the location of active cases, breaking it down by community within the districts? So whether it's locally in Lindsay, Fenelon Falls, Bobcaygeon, etc.
Thank you, Mr. Taylor. This is the most frequent question that we receive, and not just from CKL, but from our other upper and lower tier municipalities. The health unit posts updated information about the number of confirmed COVID-19 cases in each county on our website daily. We include the number of high-risk contacts, the number of probable cases, the number of people who've been hospitalized, the number of cases that have been resolved, and the number of deaths. We also provide a very detailed epidemiological report that includes information on the gender of our cases and the age range of our cases. We do not provide information broken down by lower tier municipality or community. This is done because the health unit has the legal responsibility to protect personal health information it has collected under various pieces of legislation, such as the Health Protection and Promotion Act. Although it may seem that our geographic area has a large enough population to make it impossible to identify an individual, we essentially cover 3 counties comprised of very small towns, and it would be very easy to identify someone who tests positive. A test result is a snapshot in time. If a person tests positive, that tells us that they had contact with an infected person probably about 2 weeks prior. It would have taken the person maximum 10 to 11 days to show symptoms of an infection, more time to get the test, and then time for the health unit to receive the test results back. In the meantime, before the person showed symptoms, or if they never developed symptoms, they would be out in the community. That is why I keep reminding people to treat everyone they encounter as if they have the virus. Maintain physical distancing, wear a mask if you're out and cannot guarantee a distance of 6 feet, wash your hands frequently, stay home if you're ill. These are the measures that will help keep us all healthy, more so than knowing whether someone in your town tested positive. We've learned over time that some people can have COVID-19 and not have any symptoms at all, or any of the typical symptoms. That means that people could encounter an asymptomatic person at any time or in any place. Knowing where a positive case lives will not protect someone from getting ill. We need people to recognize that COVID-19 is in the community and they are at risk of getting the virus. So it's important to follow all the public health precautions to protect themselves and stop the spread. If a person has been in contact with a confirmed case, they will be called by the health unit. Every confirmed case is contacted by our staff so that details can be obtained about every place that individual visited or person with whom they were in contact during their infectious period. Every one of the identified individuals, for example, a contact, is then contacted and told to self-isolate and watch for symptoms. If the contacts develop symptoms, arrangements are made for them to be tested for COVID-19. This case and contact management is very thorough and can take hours to complete. Health unit staff are in contact with cases and contacts daily to ensure they remain in self-isolation for the required period of time. As well as Medical Officer of Health, I recently issued a Section 22 class order under the Health Protection and Promotion Act that allows the health unit to seek fines for people who do not self-isolate after they have A, been confirmed to have the virus, B, have signs and symptoms of COVID, have been tested and are awaiting results, C, otherwise have reasonable grounds to believe that they have symptoms of COVID-19, or D, have been in close contact of a person mentioned in A, B, or C. Health unit staff are in contact with these individuals daily to ensure they remain in self-isolation for the required period of time. Thank you.
Thank you very much, Dr. Noseworthy. And again, thank you, everybody. I apologize, but I want to thank the residents that were engaged and provided the questions. There were some that we didn't get to. We will be encouraging you to go to our respective organizations' websites. Some were mentioned, to find that information. And we'll certainly do our best to follow up on the ones that were submitted directly. So before we sign off formally, I would just like to leave everyone with a couple of words or closing remarks. So first of all, on behalf of our City Council, on behalf of City Administration, and for all of the panelists here that have joined us this morning and their respective organizations, I'd just like to to our first responders and our frontline healthcare workers. The risks and sacrifices being taken have been and continue to be admirable. Thank you for going to work every day so that others can stay home and be safe. And to our healthcare providers, partners, and support teams, thank you for continuing to come up with innovative and safe ways to care for our residents, for providing options to those who have limited resources, and for taking care of those who need it most. And to the community, your response and silent actions taken, such as staying at home and continuing to distance from one another, has been the underlying strength in keeping the virus at bay. Thank you for your cooperation and understanding as we continue to navigate through this pandemic and determine what our new normal looks like. And lastly, I'd like to thank everyone who participated today in this town hall meeting. We appreciate all of your time, all of your expertise. We've learned so much. We're going to continue to learn as a group and partners moving forward. Communication is key to sharing this information and ensuring that our residents stay safe, are well informed as we move forward. And so with that, I'd just like to thank all of you and stay safe and enjoy the rest of your day. And thank you for this opportunity today.
Thank you.
Thank you.
Thank you.